Yeah, you win again lah.
Of course, I always champion one. Hey, you see outside so hot lucky thing we can play inside the RC
Yeah. With this Singapore heat, I think can get skin cancer leh.
Oh, kena cancer don't play liao
Exactly! Cancer is a serious health issue. Skin cancer, breast cancer, lung cancer, so many types of cancer. But is there a specific type of cancer that we tend to overlook? One that only affects men?
Which cancer are you talking about? Cancer.
Not to worry, gentlemen, your prized manhood is safe. But your prostate is not!
Prostate? Semi-prostate.
Well, the prostate is a walnut-sized gland. It is located in front of the rectum and below the bladder. The prostate produces fluid that protects your sperm, which means it is a gland more important than you think. Common symptoms of prostate cancer revolve around urination issues, as urine flows out from the urethra, which runs through the center of the prostate.
But all old men they have problem in peen one.
Well, that's the thing. Interestingly, people with early stage prostate cancer tend not to have any symptoms at all.
Then,
How to know?
If you have prostate cancer, lumps may form in the prostate which might be felt by a doctor during a digital rectal examination, or DRE. This involves the doctor inserting a gloved, lubricated finger into the rectum. This examination may be mildly uncomfortable, but isn't painful and only takes a short time. However, the chances of prostate cancers being detected during a DRE is low. Therefore, prostate-specific antigen or PSA blood test is also done. Any abnormalities would then need to be confirmed by a prostate biopsy.
we are safe
Walao, the guy siao
scared us for what?
Because, gentlemen, the number of local men afflicted with prostate cancer is rising rapidly. Thanks. It now makes up 1 out of 7 cancers in men here, and it is now also the 3rd most common cancer in men. That's up 4 ranks. From 40 years ago, it was 7th then.
This kind of cancer only kena the old. We only turning the 50, right?
Really? Wow, it's good that you're still so young. While an average of 6 out of 10 diagnosed prostate cancer patients are men aged 65 or older, that makes about 40% of them younger than 65. Men in their 50s should consider discussing with their doctors if they should be tested for prostate cancer. If the cancer is detected earlier, the cancer is more likely to get a better treatment outcome.
I'm the lucky one. My father, my grandfather all don't have cancer. I confirm and chop. I don't have cancer. All good. No worry.
Well, while family history is a risk factor for prostate cancer, only about 5 to 10% of all prostate cancers diagnosed are passed down from family members. When it comes down to it, the cause of prostate cancer is not known. Factors such as environment have been shown to influence genes. So, while the men in your family might be lucky enough not to have prostate cancer, you might not be so lucky. Touch wood.
Then what's the point? If you kena cancer, you should die. So, no choice lor.
Prostate cancer can range in aggressiveness. Of those diagnosed with less aggressive prostate cancer, less than 1 in 20 men die from prostate cancer 10 to 15 years later. They might not need any treatment, just surveillance, as they are unlikely to die of the cancer and more likely to die with the cancer. On the other hand, men diagnosed with more aggressive prostate cancer need early radical treatment to prolong survival. Again, think about it. Do you want a kitten or a lion?
So how? Together we go and see our doctor for the DIE and PSA.